having this hearing, and I certainly appreciate the speakers that are here today. And Dr. Walensky, I appreciate being able to visit with you last week to discuss your work as director of the CDC and the prevention. I thought we had a very good conversation. Certainly admire the work that you've done. And Dr. Shukat, I certainly admire the work that you have done over the past many years. I'll be brief with my questions, but one thing that I'm really concerned about is rural health care. I had the opportunity this past Saturday morning to visit with David Reddy. He's a pharmacist in a town in Mississippi, Monticello, Mississippi, that has less than 1,500 people, and the concerns that he has about them being able to get their medicines, the reimbursements they get, because they're such a small, they don't buy in bulk. So those are things that I'm sure that we will be having other conversations about. But the COVID-19 pandemic was highlighted numerous aspects, obviously, of our healthcare system that needs improvements. One of them that we all recognize is the disparities America's living in rural health areas, facing our rural health areas. But addressing health infrastructure in rural areas is a serious concern, and as I said, one of my top priorities. And while the CDC has undertaken efforts to address that, there is no entity within the CDC tasked specifically with this work, and that's concerning to me. I believe establishing a new Office of Rural Health within the Center of Disease Control would be an important way to support rural communities through the end of this pandemic and to prepare for any other future public health crisis that we could be faced with. And, I just envision this office to be empowered to look across CDC programs to ensure the work of the agency is properly addressing the health needs of the 57 million Americans who live in rural communities.